In this video, we're going to look at health policy in America. Now, when we talk about health policy in America, what we're really talking about is health insurance. And it's worth discussing what exactly insurance is. Insurance is a tool for mitigating risk. Let's look at a crude example. Let's say I own a house and it is in an area that is prone to some storms and floods, and I'm worried that my house could get destroyed. My neighbor happens to be in a very similar location, suffers from the same potential risks. Now, if one of our houses was to get destroyed, it would be extremely costly for us to repair it. Now, together, if my neighbor and I decided to put a bit of money aside in a risk fund, we would jointly pool our money together, and anyone's house that got destroyed could access this money to help rebuild their house. What we're doing is we're pooling our risk, or we are transferring our risk. We're trying to share that risk so that the cost would not be so devastating for the one person that happened to. Now, if we could convince a lot of our neighbors to join this risk pool, then it would be a lot cheaper. Each individual homeowner would only need to put a little bit of money into this giant risk fund. And then if anybody needed that money to repair their house, they could draw from it. That's exactly what insurance does. Insurance is transferring risk or pooling risk so that individual members might be able to reduce their individual costs. Now, does that same logic apply to health insurance? Can we do risk pooling for health care the same way we do for auto insurance or home insurance? And one famous economist, Kenneth Arrow, suggests that we might not be able to, and there's a few reasons why. There's information problems with healthcare markets. We don't know how healthy individuals are. We don't know if the treatments are going to work. We're not sure about the quality of doctors. A lot of the same problems that are in markets for used cars, for example, are present in markets for healthcare. What about the moral hazard problem? If we are covered by health insurance, we might be more risk averse. If I know that my health insurance will cover my health care, maybe I won't take as good a care of myself. That's called a moral hazard problem. Also, just the firm dynamics. How do healthcare firms work, and how does health insurance go about pricing risk for individuals? It doesn't operate the same way as other profit maximizing firms do. Again, this was spelled out by Kenneth Arrow in a famous 1963 piece. He talked about the difficulty in attaching prices to some of these things, prices for services, especially when you don't know the services are going to work. Each individual is different. We all have a very different health industry. And again, with the information problems, we don't know each other's health history. So if I'm a healthcare provider, I do not know exactly what your susceptibility might be to certain diseases. So it would be tough to put a market together for health insurance. And then, of course, there's the possibility that in the aim of maximizing profit, we might forego opportunities, medical advancements that might do a social good. So there's a lot of reasons why health insurance markets might not work the same as other markets, which often justifies a role for government in providing health care. Now, there are different ways, different models of healthcare provision. And before we discuss which ones are used in America, we'll look at the four common types of healthcare models. One is the Beveridge model. This is called government provision. This is the type of healthcare they would use in the United Kingdom with their National Health Service. All doctors work for the government. All hospitals are government-run hospitals. The government runs and administers the health system. There's also the Bismarck model, which is sort of similar to German sickness funds, where individuals might pool their money or pool them together with an employer to create a large sort of insurance pool. NHI model, or single payer, national health insurance. This is similar to the model we have in Canada. Hospitals are run as individual entities, doctors are independent contractors, but the person that ultimately pays the bill is a single payer. That's the government. So the consumers don't pay directly, but rather the government pays the providers through a single national health insurance model. And then, of course, there's the out-of-pocket, pay-as-you-go model. There are many paramedical services that we have to pay for out of our own pocket if we don't have benefits, things like massage or even dental care. Those are just regular out-of-pocket expenses, or you could buy specific insurance for those things. Now, which one of these do they use in America? It's a bit of a trick question. They use all of them, depending on who you are. The American population is covered by a lot of these different models. For example, if you have been in the armed forces and you are finished your service, you are under the Veterans Administration healthcare option, which is provided and run by the government. If you have health insurance from your employer, that is a type of Bismarck model. Most Americans that have health insurance get it from some kind of employer health plan. If you are a senior citizen or if you're a low-income individual that meets a certain income threshold, you qualify for government-funded single-payer healthcare like Medicare and Medicaid. The government reimburses providers for the expenses for covering those population groups. And then, of course, some folks that are uninsured might have to pay for individual medical services, or uninsured might choose to buy their own private health insurance as well. All of these are present in the American healthcare system. Now, how does that break down? Well, in a population of roughly 330 million people, most individuals get some kind of employer-based healthcare. There are some that are, again, you can see they're from the military, that would be falling under the responsibility of the Veterans Administration and that government provision. There's Medicare and Medicaid. And then there are some folks that have either their own private insurance plans or that go without health insurance. So there are a lot of different options available to Americans. So just to recap, health insurance markets are problematic. It's tough to put prices on these things, especially when you don't know people's health history and you don't know about the certainty of the outcomes. You don't know if the procedure is going to be successful or not. That often justifies a role for government in providing health care. And the American health care system provides several different models to different groups of citizens.